happy with your life, or has it been trying to get your attention, screaming, "Hey, look at me"?
What is your body trying to tell you? Shawl Turner's here with a look. I love this series, Shawl.
Yeah, probably telling all of us, can you please get some sleep? Well, have you noticed that maybe if you're losing your hair or if you have stomach problems lately, that it may happen more times than it doesn't happen? There could be a reason for that. So Dr. Kristen Woodward is here to answer our questions. All week, you've been really giving us some great info. And the whole part about the hair, we're talking men and women as well, right?
Absolutely. A third of women can experience hair loss at some point of their life. Most of the time, it's from genetics, just a family history. Women tend to lose hair on top of their head compared to men who lose it around the hairline.
Wow.
But it can also happen to both men and women when they've experienced a stressful event in their life, such as a recent surgery, illness, hypothyroidism, a low blood count such as anemia, or even pregnancy.
Wow. So I mean, is there any way to prevent this? Because a lot of people just, they say, wow, this is hitting me early. I thought I'd be later age and I'm seeing this hair loss.
Well, like I tell all patients, you know your body best, and it's really important when you have a gut feeling and something isn't going right to talk to your doctor. Preventing it is difficult, but if you notice it, absolutely speak up and talk to your doctor, because there are some treatments out there that can be helpful.
And we've seen the commercials, minoxidil, Rogaine, that stuff really work?
And it's approved for women as well.
Well, that's great. But I heard if you stop using it, though, it can make you lose your hair if you stop.
It would be something that you need to talk to your doctor about,
Oh,
and something that
okay.
you likely need continued treatment for.
All right. Okay. Well, let's move on to stomach problems, indigestion, things like that. I mean, every now and then somebody's going to overeat and have some issue, but when it just keeps happening, what's the deal?
Right. So especially burping. We burp when we eat. It's normal to get rid of that gas. But if you're burping all day, it could be a sign of acid reflux, which really needs to be treated, because there can be some damage to the lining of the esophagus,
Sure.
or it might even be a stomach ulcer.
Wow, that is so interesting. And then there are little things that we do, I'm sure, that could make it worse. Like I understand that you shouldn't take a lot of ibuprofen, Advil, that kind of thing.
Absolutely, especially if there's any history of an ulcer. Advil can make it worse. Lying down after you eat a large meal is something you want to try to avoid. So those are some things as well. Caffeine can make it worse as well.
What about that old thing? Everybody says, oh, I'm going to wear my sweatpants to the all-you-can-eat buffet because, I don't want to get sick. Does it really matter if you have anything binding around your lower abdomen while you're eating?
Well, you think of it, I always tell my kids, the stomach is about the size of your fist. So that's about how much you want to think about eating during a meal.
Oh.
Now, if you do have a tight pant on, it can make you eat less.
Oh, well then, okay.
That's a good hint.
So you can wrap maybe some surgical
Right.
stuff around your stomach and eat less. Well, thanks, Dr. Kristen
Thank you.
Woodward. Always such a joy to have you here, and it's been valuable information this week. So, Greg Dutra, I know you're always, concerned about what you eat. And
Stuff in my mouth.
that's right. So what are you going to eat for lunch?
I just had a piece of deep dish pizza, so it definitely was not the size of my fist, I'll tell you that. Maybe my forearm. Let's take a look at Pinpoint.